Welcome to Intake. If you haven't already, why don't you hit the subscribe button and then the notification button so each time we drop an episode, you will be notified. Since COVID-19, the health disparities of African Americans have come to the forefront, but so have other issues in America. There is a breadth of consciousness as we look at the causation behind these disparities, such as environmental factors, or better yet, the long history of mistreatment that African Americans have had to consistently face. Western society, with the continued push from white racists and political parties disregarding the conversation, has played a significant role in these disparities due to the psychological response from chronic stress associated with racial trauma, from the ongoing terrorism toward African Americans in Western society. The contributing factors of systematic racism has birthed a great mistrust in the medical and mental health field, but it has also conditioned the thoughts and behaviors associated with the African American community through racial conditioning, false narratives, false power, and control. Throughout this series, joining me will be other professionals within the community to uncover what's really beneath it all in the African American community and hopefully introduce a resolve. It's time to shine the light from a mental health perspective. Before we start, why don't you all give the viewers some background information on yourself? And Ms. Evelyn, why don't you start that?
Evelyn Hulse. I'm coming from the human service field in an array of disciplines: substance abuse, social work, the last 25 years. Currently, I am in the Midwest as a elementary school counselor, working with students primarily using motivational interviewing and social emotional learning.
Beautiful. Miss Gina.
Hi, I'm Gina Mckinney. I'm a licensed clinical social worker in the state of New York. I currently work as a strategic planner in a hospital, really focused on healthcare transformation. But I have also spent most of my career doing private practice with patients and building programs for people that need programs in our communities, whether they be for maternal health or HIV. I spent much of my career building and managing programs.
Nice. Ladies, let's just get right into it. Starting with the numbers of deaths since COVID-19. You all have seen how the news have portrayed that African Americans are dying, at the highest rate. So there's different type of information out there. Most of it is saying that African Americans are at higher risk, we're dying quicker, faster, at a larger rate, all of that. But for me, when I look at the CDC numbers, what I see is the numbers of Caucasians deaths are much higher. And then African Americans are falling in second, and then the Hispanic community. And while I don't want to excuse that because we don't want this to happen across the board, but I do have some concerns about it, these different media outlets making it appear that, look, African Americans are just dying like flies. And it's because of these health disparities that, the African Americans struggle with. So you all tell me your views on these numbers with the media.
I work in a hospital, and regarding the numbers, yes, there are more Caucasians dying. However, there are more African Americans dying in proportion to the population of African Americans in the United States. So though, it's the percentage that really matters. So 2/3 of us are dying at higher rates than our white counterparts. I mean, we represent 13% of the population. So, that amount of people dying, it really does suggest that more of us are dying than we are surviving this virus. And yes, there's a correlation between comorbid conditions, but there's a correlation between environment, and there's a correlation between treatment and where you are seeking treatment. It really depends. Those are incredible cofactors why people are succumbing to the virus.
Well, and Gina can also attest to this since you're in the hospital. I often wonder if we're getting an accurate reflection of these numbers, especially when you have different media outlets reporting that people of color are dying at a rapid rate. How is the CDC actually keeping an accurate count when we also know that we are delayed in any kind of when we're unable to actually provide appropriate testing, especially to the folks that are in the inner city communities. So therefore, I often say proceed with caution when you're hearing and seeing these numbers.
I'd agree completely. And that is because there have been a number of people who have expired at home and en route. And sometimes they're counted as COVID-19 and sometimes they're not counted as COVID-19. The numbers are skewed. You really are not getting a clear picture of what's happening and how people are really being impacted of color by the virus. What they're counting are expirations in the hospital. So that's where the numbers are coming from, and from the coroner. But there have been a lot of advisories that have at least occurred out in New York, where if someone was, coded because they had cardiac arrest, you were told to leave the body in, where you found it in the home, not to bring the person to the hospital. But no one knows if that person also had COVID and expired, because as time went along, we began to understand that COVID just didn't affect the lungs. It also affected the heart, the brain. They began finding the virus throughout the body. So, and there are several different strains of the virus. It's not just one. There's about 30 different strains of the virus currently. So they are doing, I would say, probably the best that they can to present a picture of what is going on, about how people are being impacted and affected, particularly people of color. But are the numbers skewed? Can you trust them 100%? No. I think as time goes along, they'll find a way to refine the numbers so that you have a better sense of how people are truly being impacted and who's really expiring. But we can say this with some certainty: the numbers do reflect that something dramatic has happened, something devastating has happened. People of color have died. So we know that we are being affected far more than our white counterparts.
So ladies, let's get to it. These health disparities, because as an African-American woman, I know for years, as I have gone to the doctor, doctors have always said to me, well, you're at a higher rate for hypertension, diabetes, and it's basically because of my race. And I have actually fired a couple of doctors because I just didn't think they were listening to me when they were proportionately looking at the way most African Americans eat,
Right.
how they care for themselves, different things. And so if I'm telling you that, hey, I'm a vegetarian, and I'm telling you my health routine, and you're still looking at me as just an African American woman with this higher rate, then for me, you're not listening.
Right.
I just kind of fire them until I find a doctor. And right now my doctor is a Hispanic doctor, and I'm comfortable with her because she takes the time to listen. but also I understand as well what's behind many of these health disparities. In doing the research, just to back this up, I've found that what is happening is what we know to be as chronic stress, which is a stressor that happens longer than a month. So ongoing for years can affect the immune system and cause what we know as autoimmune disorders. And so when I look at African Americans and I'm doing the research, it's not like we're biologically different. Our makeup is biologically different. What I'm seeing is that because of the many stressors that we've had throughout history, starting with the slavery, and we're going to get in this eventually with the epigenetics. But when I look at it and I do the research, I see how the trauma, the ongoing trauma that we're constantly seeing with African Americans being killed, discriminated against, so many different things, how it affects our health.
Well, I've always been an advocate for people of color owning their health. Mm-hmm. And when you go and see your doctor, a mental health practitioner, if things don't sit well with you or don't sound well, chances are it's time to, like you said, fire and move on and find someone else. So I think if you go in with the understanding that I'm in control, I need to own my health, I need to understand that when I get a diagnosis, I've got to go do the research myself. It may entail getting a second opinion from someone. But I think for a lot of African Americans, you've got to educate yourself. When you get a diagnosis of you're a diabetic, it's not I have sugar. Mm-hmm. You know, it's what does that mean? What is that going to look like moving forward if that is a true medical condition for the individual? Now you have to think about how am I going to live my life differently? You can't rely on the medical community to kind of define what healthy living is. It's a lifestyle choice. You have to determine that that's what you're going to do. And when you go to your medical doctors, if you're not understanding and you can't have a dialogue and you can't be comfortable, you've got to find someone else. Yeah. But I think first and foremost is accepting responsibility for your health, mm-hmm. taking complete control of it, and educating yourself.
Okay. Ms. Gina, what do you say about that?
I agree. I agree that you have a responsibility. I do think that people of color and patients of color in, at least in New York, in the North, have to also understand that this information sometimes is not readily available. So what has happened with healthcare transformation is that the responsibility is on the institution and the provider to ensure that patients begin to understand mm-hmm. what it is that they're challenged with. There was a time, particularly with safety net hospitals, who rely heavily on Medicaid dollars. The system here was being drained. The Centers for Medicaid and Services was spending a lot of money, helping hospitals stay afloat. And that's primarily because the cost of Medicare really doesn't pay for what they pay in Medicare doesn't really cost for in Medicaid. It doesn't really pay for the cost of true care. So, of course, if providers are not, have a personal integrity, getting in there and making sure that they're informing their patients or understanding that the patient is not getting what I'm saying. So what is my next step in helping this patient? Because they're not following, I'm not quite sure why they're following. What I've noticed and what I've experienced in my 30 years is that sometimes there's apathy. There are times there are providers who just, and there are a lot of providers in areas, in safety net areas and predominantly Black and Hispanic areas, a lot of them are foreign-born doctors. They're not doctors that are born in America, trained in America, and provide care here. A lot of folks from America want to go to more prestigious institutions, not necessarily safety net hospitals. Yeah. So they, they would treat a patient and they would leave it up to them, and they would make, determinations that the patient doesn't care. They're not following orders. But there's a lot to the backdrop of that. Mm-hmm. People really need to understand how the mechanics of how to change their life, given the fact that their environment is not changing. In terms of eating healthy, having a healthy diet, one, you have to consider finances, and two, you have to consider availability. There have been a number of studies within the area that I work, which is called participatory action research, done by high school students and college students that lived in the community, constructed the questions, and went out and polled the community about what's really important. And the feedback that came back is that folks want healthier lifestyles. They want to have gyms, but gyms aren't in the neighborhood per se. If they are, they can't afford them. They didn't have bike share here. They recently started putting bikes. They were only putting bikes in neighborhoods where they felt folks would ride them or had the financing to be able to take their credit card and rent a bike. So there's been a lot of change and shifts. There have been food deserts. So if you are in a neighborhood and you want to eat and you have a family to feed and you're near McDonald's and you're near a Whole Foods and you have $20, you're going to get more out of McDonald's to feed your family, because the idea is about being full. So, and what happens is the palate gets conditioned to that kind of eating. So it really is a process in terms of teaching, reframing, in our clinical work, reframing so that patients and people of color begin to understand that I can do this. I can retrain my palate. I can retrain my lifestyle. I can find food that's available and affordable that will help in terms of my comorbid, not being susceptible for particular comorbid conditions that are rampant through our communities. But the idea is it's what COVID did is it uncovered the disparities in this community. Mm-hmm. The things that we've been talking about for years. COVID just blew it wide open and said, no, it is a difference between the way you're treated versus the way you're treated. And being in my field, I have the opportunity, especially with research, that communities that you can probably a mile and a half away are dying or not dying. For instance, someone with hypertension in another community, their life expectancy will be 80, whereas in the community where I work and live, the life expectancy for the same comorbid condition is 70. So what's the difference? It's diet, it's availability, it is what's really happening with the healthcare, how we're following through, are we ensuring that? So now there is opportunities to ensure, to help the systems to be able to address these comorbid conditions in a more proactive and effective way. And we're hoping. And COVID has demonstrated that we were not doing the job before. And this is what we need to go forward, because this many people of color would not have succumbed if they had understood. Remember, there was some issue with folks thinking that they were not susceptible of color. They thought they couldn't get it. And then when they realized that they could, it was too late. We were in the throes of it. We were in the peak of it. And then remember, people of color typically live in more dense, they're densely populated, whether they live in a project housing, it's not spread out in homes. They may have multiple people living in one apartment. So there are a lot of factors that contribute to why we were more negatively impacted.
Chronic stress among African Americans, Hispanics, and Native Hawaiians are also associated with hypertension and diabetes. Perceived racism and discrimination are contributing factors to chronic stress. Systematic racism is the leading cause for chronic stress that influences health disparities among African Americans. Even after socioeconomic status has changed and adjustments to health behaviors have been improved, Blacks are still at a higher risk of heart disease, cancer, stroke, diabetes, kidney disease, and hypertension. Racism and discrimination causes African Americans to be at a higher risk for health disparities. Don't get it twisted. Racism is the disease.
And what the virus has done also is to give you a clear depiction or vivid lesson between race, class, and inequality in America.
Absolutely.
Yeah, yeah. Something that has been ignored for so long, or can I say not so, well, I can say ignored because most people try to act like it's not an issue. There is not a race issue in Western society. We're done with that. So, Gina, I like a lot of what you said, and Miss Siobhan, because this is a mental health talk show. And so when we look at African Americans and including the health disparities, the ways of thinking, because I was bothered personally when I was coming in contact with individuals saying, oh, we can't get the COVID because of the melanin in our skin. And so I was bothered by this way of thinking. The same way I'm bothered a lot of times with the small changes that we can make to help our health, but we refuse because there's this idea of, oh, I gotta die of something. And so for me, it all starts in the mental. And if we can change improve the thought process within the African American community, and not only that, help them identify how this thought process came along, then I think we have a better chance of helping those in the community move forward and make better choices. Thus is why we're having this conversation. So I just want to share with you all some of the causations behind these health disparities. So when I was doing my research, I found out that, as I said earlier, chronic stress has a very adverse effect on the immune system.
It does.
It really does. And so one of the resources in particular that I looked at was the Institute of Brain Potential, which focuses on psychoneuroimmunology. This is what I found out. In our immune system, as we know, our immune system, it fights off, it helps us stay healthy. So it fights off viruses, it fights off foreign objects that comes into our body to help us. We have white cells all throughout the body. There are 3 in particular cells, which is the T, B, and what they call the killer cell, that helps us fight off viruses, helps the immune system detect when there's something going on in the body. And so what happens is these 3 different cells, we know when stress occurs, this stress hormone that we identify as cortisol, what it does is it releases in the body. And so that's our body's alarm system to say, hey, something isn't right. We need to work it out. But when the cortisol is released, what happens is a lot of the functions in our body that would get in the way, including our immune system, is shut down. And that could, because this fight or flight response is triggered. And so we need to be able to act quickly, think quicker, and not have things slow us down. So certain organism in the body is shut down. And in looking at this, they found out of years of research. We talk about stress as mental health professionals, but it's not like the everyday stressors that is causing effects into the immune system. It's stress like segregation, being discriminated against, being shamed, feeling perceived as less than, being in a group, like a racial group that is judged often. It's those kind of stressors that are causing problems within the immune system and breaking the immune system down and actually weakening these white cells to cause adverse effects like hypertension, diabetes 2, all of these health disparities that they say we have in the health in the African American community. And so this is chronic stress, meaning that it's the type of stress when you're not sure when it's going to end.
Right.
And it has happened for years and years. And when you're constantly processing this stress, cortisol levels are constantly released in the body. And so what they're finding is when cortisol levels are constantly released, they become high. So high cortisol levels are bad, but guess what? After chronic stress, they start to lower. They start to decrease. So once you're constantly releasing cortisone because of stress, constant stress, then these cortisone levels start to become low. And either one, high or low, it causes an effect in the body. But we have to be careful because when it's low, that means that our white cells are being attacked. And the immune system is in danger. And then we have these autoimmune disorders like heart disease, like hypertension, like diabetes, including cancers. Yeah, different things like that. And so when I'm doing the research, and I know as an African American that I have been in society in different areas, including the workforce, and oftentimes felt judged based on my skin color. And there are days when I walk out the door, or let me just say this, better yet, because we have a bigger problem with our African American men. When my husband walks out the door, when my brother walks out the door, I'm always on the alert because I'm not sure what's going to happen to them as a Black male. And this is that ongoing stress. This is that chronic stress. And it has been going on for years and years and years. And so when we look at the health disparities, we have to understand that there is a psychological response that is causing a physiological response in the body. And it's based on the environment, the social environment. It's based on, all of the stressors that African Americans have had to go through throughout years. And truth be told, we've gone through these stressors, these traumas, and we're the only race. Can I just be real? We're the only race that Western society has not owned up and said, look, I'm sorry for what I did to you all. And so I want to know your thoughts on that, because when I do the research and I look at what is going on and how all of this is causing an effect on our body, because there are days just being in my brown skin that I am tense a lot of times when I go into certain places. And I don't care how dressed up I am, how good I look, and how much money I make. If I go into certain places, I'm going to be quickly approached as a Black woman. And so,
well, I mean, you've commented on some key points that America has not ever acknowledged or been apologetic for slavery. So, and that's been a determinant for a lot of stuff that has happened to us as a race in America. I don't believe there's ever been a true acknowledgement of slavery and a true apology.
Right.
Which again could tie us to looking at our history, going back to 1812 and antebellum era, moving from that, going to Civil War, going right into the civil rights, just to go back and see how African Americans have been treated. When slaves during the antebellum time had ran away from their slave master, it was considered amputation. There was a psychological diagnosis back then that was given to slaves. They were considered runaway slaves. Therefore, we're going to amputate you. If we amputate you, you can't run away. So we can go back all the way to 1812 and start to look how African Americans have been treated. And here's the outcome today. And this virus is only bringing forth the issues that have always been present in healthcare.
Yeah. Not only that, though, but we still have it going on. I know for me, and as I came closer to doing this, I had to check my emotions because of the recent death with Aubrey. We all know the young man that was jogging.
Yes.
And I know personally, I am simply up to here and tired of turning on the TV and seeing my own being shot down for no reason, being killed for no reason.
Right.
That alone does something to me as far as a stress response, because it's showing me that we still haven't, as much as we want to say we've moved beyond this whole race issue, we haven't. There was an issue there. And it does bother me and so many others when you turn the TV and you see these things and the people that are doing it are not, unfortunately, they're not, justice is not being served. And so there's a constant response always going on, especially now, because there is this issue with white supremacy now sticking their head up and saying, okay, this is our country, which they've always thought. But even now so much, they've become really bold about these issues. And so that, again, is a stressor for many African Americans. And it touches us all. And because it's touching us all, if we're not able to control this stress, then of course, it's gonna cause something to happen in the body, because every cell in our body hears from the environment. It listens to the environment and it responds. And we know with every emotional response, there is a physical response. So Miss Gina, tell me your thoughts.
Well, it has been completely overwhelming at times to listen to the amount of people of color, particularly men, who have been gunned down during COVID. I mean, I understood this was going on prior to COVID. Mm-hmm. I think I became stunned and overwhelmed with the idea that it was happening during, this period of time. I didn't expect it. And that's because we have shelter at home orders. Folks are not gathering. But to me, it seems like, folks still found a way to seek us out, and particularly the men seek us out and to find reasons to destroy us, to kill us, murder us in such vile, indifferent, and cruel ways. When we're talking about 13 shots, 14 shots, not one to subdue. It's really been remarkable in my experience that this is happening and happening at this level. And the Aubrey situation was really, it was very difficult for me to watch the video, but I did watch it over and over and over and over and over again, because I understood the whole issue of fight and flight. You have someone approaching you in this manner, and what goes off in you, it goes off in you. Can I actually engage in a civil conversation with these men where my life will be protected? And I guarantee you, he said no. Mm-mm. The only thing I have is to get out of there. And even in doing that, they killed him.
Yeah.
But when it comes to, just the whole thought about what we're dealing with, yes, you're correct. Stress does resonate in the body. Yes, it's because we have this idea. We are conditioned to think this way. We are conditioned to believe that we won't be heard. We are conditioned. Many times, providers will talk about how Black people are angry. And this is I had a very interesting experience, because I taught family medicine as a behaviorist, family medicine residents, and PGY 1, 2 through the 3rd year, and really gave them a platform to be honest. And they, like I said, they typically did not offer slots to people of African American backgrounds. It would be people of color, but they would be from another country. It would not be from local area. And in terms of giving back, so I would just open up the floor and say, look, please just feel free to be honest. There's nothing you can say that will offend me as a Black woman. Mm-hmm. And they would be honest, and they would be from different countries, and they saw Black people as angry. And I would work to reframe that with them to say, but why would they be angry? If they feel judged, if they feel like they are not listened to, what do you think they're going to do? Speak louder, more aggressively, in the hopes that you will hear them, in the hopes that you will understand them. And at the end of the day, we still have pride. Everyone's makeup is the same as you said. We have the id, the ego, the super ego. We want to feel respected. We want to feel like we have ownership in what we built. We want to feel like we matter, like our lives matter. Mm-hmm. but everything that we do is taken out of context, particularly the Black Lives Matter hashtag. It was in response to the fact that white lives always matter. Mm-hmm. We're saying our lives matter too, but even that is taken out of context to say, you're saying other people don't matter. No. And we don't know how to have this, having this conversation sometimes is so challenging. And yes, the tactics that they use during antebellum is really about, you are going to be controlled. You are going to be subdued. You are going to be conditioned to doing it the way that we need you to do it. Because after all, this is a business plan, and you are a product in that business plan. And you are to continue doing the work that you need to do so that we can live this life that we want to live. But the more you gain information, the more you feel centered, the more you feel the ability to really be able to advocate for yourself, then we are threatened.
Join us next week for part 2 of episode 1, Beneath It All in the African American Community. If you're a professional who would like to be on the show, or an individual who has struggled with mental health and would like to be a guest, email us at info@intake.tv.
Follow us on all of our social media platforms.
If you'd like to learn more about Intake or our guests, visit our website at intake.tv. Join the conversation by making a comment below.